Good evening, everybody. Thank you so much for joining us on episode 2 of season 1 of All Things Women. So, tonight we'll be talking about a very big topic, but this is the first of many episodes to come around the topic of infertility. We're going to be talking miscarriages, we're going to be talking infertility in itself, we're going to be talking about child loss, about parenting, and all of that. But tonight we're zoning in on infertility. What is infertility? We're going to tackle it from the medical side, but also from the mental side, because it does affect you. It's not just something that happens to your body, it's something that happens to your mind. Clementine, Busi, Randy, it's so lovely to see you guys. We have got two medical doctors two gynaes in the making, who are going to tackle it from the medical side, and Clementine and I will talk about the emotional side. But to kick off, because we did say season 1 is centered on Proverbs 31, the Proverbs 31 woman. So Busi will open up with a script from Proverbs 31 that speaks about what, Busi? Over to you.
Sure. So good evening, ladies. Good evening to our audience. I'll be reading from Proverbs 31, verse 27. She watches over the affairs of her household and does not eat the bread of idleness. And then verse 28 reads, her children arise and call her blessed, her husband also, and he praises her.
So we're talking about Proverbs 31 mothering. So that doesn't apply to you if you don't have children yet, but it applies to you if you don't have children because fertility is a thing, right? But now, like we spoke about in episode 1, this idea of becoming this Proverbs 31 woman, what then does it mean to be a Proverbs 31 woman that's struggling to have children? Rendani, your thoughts?
True. That is quite interesting. I find that women feel very pressured when they're not able to have children. And especially since last week we started off saying, what is a Proverbs 31 woman? I find that in my circles and at work generally, women that try and aspire to be this Proverbs 31 woman really struggle with the fact that they can't have children and they feel like they're less than, they almost like womanhood is defined by whether you're able to have children or not. And people really, really struggle around that. I can go into the definition of infertility so that generally everyone out there knows what we're talking about.
Yes, please.
So there's two types of infertility. There's primary infertility and secondary infertility. Primary infertility means you and your partner are basically trying to conceive for over a year without being able to. And that means you haven't had any children before. So we define it at the year mark. That means then, we define you as primary infertility. It doesn't mean it's impossible for you to conceive. It's just a definition, a medical definition that we use. And then secondary infertility, that applies to women who've had children and then after that now have ceased being able to have children. There's multiple different causes for both. And but that's basically the medical definition of it.
Right. So let me see if I understood properly. So with the primary infertility, we've been trying to have a baby for a year and nothing has happened. Whereas with the secondary infertility, we have one or more children, but the next time we try and conceive, how long is the period? Is it also a year where we can then say that we have secondary infertility?
So that's the interesting part. When you're younger than 35, yes, it's a year. But if you're older than 35, then around 6 months, we start saying you have secondary infertility.
Right. So you mentioned, Rendani, that there's a lot of factors that contribute to primary and secondary infertility. Busi, maybe let's hear from you. What are the, well, unless of course, Rendani, you want to answer, but no pressure.
But I'll leave Rendani, you can continue and list the cause of the different types of infertility, and I'll come in after that.
Right.
Without being a medical textbook, I'll tell you high level what they are. So there's structural issues. So that means there's something wrong with the womb, there's something wrong with the fallopian tubes, there's something wrong with the ovaries, and then there's hormonal issues, meaning your hormones are out of balance or out of whack, or they can't produce eggs, that type of thing. And then there's also environmental issues. So something that has happened that caused you to not be able to fall pregnant. And I would basically put infections also under that. So infections can also cause you to be unable to conceive, or struggle rather. Let me not say unable, struggle to conceive. So there's different groupings, but they basically, the major ones are under structural, hormonal, and environmental.
Well, thank you for that. Busi, would you like to pitch in? What are you seeing?
Sure. So I think I want to speak from different aspects. Yes, that as a medical doctor, but I'm also going to speak, in fact, primarily as a child of God. There's a certain, we need to grasp a certain understanding of how we define ourselves. And I'm saying that in terms of the tongue. I saw Rendani corrected herself and she said, no, not unable to, but struggling to, So what I've seen and what interests me a lot is how when females are struggling, when they're struggling to conceive, or they've been defined by the textbook as having infertility or being infertile, how when one comes into agreement, right? When one comes into agreement with that diagnosis, in what I've seen, I think that it kind of makes it a bit more difficult. Let me break it down. If you read Proverbs chapter 18, verse 21, we are taught that the tongue has the power of life or death, and those that love it will eat its fruit. So the adversary has come to accuse. The adversary is the enemy. The adversary is the kingdom of darkness. The adversary is the enemy of the children of God, or anything going wrong to oppose the light, right? So you receive a diagnosis from us doing our job as medical doctors, defining things. Then when you allow yourself sometimes to come into agreement, it makes it more difficult. That's what I'm saying. So I guess what I'm playing here is really, it's difficult because yes, we're supposed to diagnose and tell you that you have primary infertility or secondary infertility, and oh yeah, your chances of conceiving are really slim because of the structural defect. But then again, why did Jesus Christ die on the cross? You see, so that's the aspect I'm coming from, and that I watch and I feel compassion. I feel compassion for the patients, not only to be given such a diagnosis, secondly, to see the impact that it has on their marriage, especially when one partner starts to blame the other, when the blame game starts to be in play, when perhaps the husband had a child in a previous relationship and thus he's proven that he is fertile, and now it looks as if the problem is the woman. So from that view, that's what I really, what I see, what I probably pay attention to most, and what really tugs at my heart. Yeah.
Can I just jump in there?
Yes, please jump in, Randy.
I really like what you said, Busi. When you said that it seems like the woman is the problem, because what I find is that most men actually don't even want to get tested, but women will undergo all these invasive. By invasive, I mean like they'll have operations and put themselves under anesthetic risk and have an operation, which is a big deal, all to just try and find out if they're the problem. But the man hasn't tested. And actually, that's 40% of the problem. 40% of males are infertile as well, under this definition that we put them as infertile. So it's actually quite a large number that has male infertility. And like Musi was saying, that he'll have had a child in another relationship, but that doesn't mean he can carry on having children, And women are put under all this ton of pressure and stress to say it's them, when in practice I'm finding a lot that actually women undergo through so much to find that there's nothing wrong with them. And we can't even test the men.
Right. I just have to say, before Clementine, I come to you, this platform excites me. Every time I think about what we're going to be talking about, I get so excited because we're meeting medicine with spirit. Because what I see a lot of is young women that either just got married, 2 years into their marriage, they're unable to have children. And they come in and they say, we've been diagnosed with X, Y, and Z, but I'm really trusting God. I am trusting God to give me the baby that I've been praying for. And it is so amazing. I think perhaps Clementine and I are maybe in a slightly more flexible space in terms of our jobs to bring in, because, when somebody says to you, I'm trusting God for a baby, I can then respond to that. Whereas it might be more difficult for you guys and, in the more medical field that you're in. Clementine, what are you seeing? What are you finding? Because now you and I are speaking about the mental side of it, the more emotional side of being diagnosed by Busi or Rendani or one of their colleagues to say, oh, this might be a little bit difficult for you. What are you finding?
Yeah, I think in practice, I don't see a lot of women who are coming in saying that they struggled with conception. I think people usually don't necessarily consult. I don't think gynaes would say, you know what, maybe you should go and see a therapist to kind of help you go through the challenges of conception or accepting that you could be infertile, what other options are there, in vitro, and all those things. And so I don't think that there is a lot of emotional support from that. When people come, it's usually at the end where somebody will be like, I have been left, or my partner cheated on me because I couldn't conceive a child for them and things like that. I'm new, maybe that's the reason, but I haven't had anyone who come in and say I'm struggling with infertility and how can I get help, because I think people just normalize it. And like both ladies have said, that it's both a male and a female problem. And so a guy would always say, you know what, I also need to test your partner to make sure that it's a couple thing. Infertility is actually not a individual thing. It should be seen as a couple thing. And in my personal experience with friends that have struggled with infertility, once they come together and say, we are infertile, or we are struggling with infertility and we need help as a couple, there's a sense of relief, and there's less depression and less anxiety, because then people can explore other options together. I think I can think that people who are most likely to suffer from mental illness as a result of this are people who are going through this individually, and the partners are not necessarily coming into play. And it could be either way. It could be a male person who's struggling with infertility, and then the woman says, oh, okay, I'm not getting involved. If your sperm count is low or your sperm is not so strong, I'm out of here. So it could be either way. I don't think it's only women, but I think if we see it as a couple thing, there's less pressure and less anxiety. So yeah, that's my take.
Sure. You mentioned something quite important, and I don't know how much of our audience are gynaes, but this is a request from us, from the mental health care side. When you do have patients who are struggling, please refer them for therapy, because I have seen, like I said, young women who are recently married, and it really puts such a strain on the marriage. It's your first or your second year of marriage. The honeymoon phase is it's fading, and now we're trying to start a family, but nothing is happening. And it becomes incredibly depressing and anxiety provoking, because we hear the stories of he took another wife, or he was a mistress because the wife could not conceive. It's quite heartbreaking. And I think more than anything, the silence around it, the secrecy and the stigma around around men and women struggling to conceive children, having a man in therapy and saying, I'm able to conceive with my wife, I think that would blow me away. We don't get that. So how do we break down the stigma, the secrecy, and the silence around this? What are your thoughts, ladies? This is for anyone.
Yeah. Yeah, can I come in there? You know, I think the matter of stigma is really a big one, you know. And if you also look at it on one end, you find prayer warriors, you know, you find women that are strong believers that also understand that Jesus Christ died on the cross for them to receive healing, you know. But the secret things known only to God, we don't know. And I suppose every individual family will have their own challenges, will have their own battles and all of that. But I think the part that makes it, you know, quite difficult is somebody who says, I've done everything. I'm a
Right.
firm believer. I've prayed. I've fasted. I've been to every single, you know, gynae. I've done all the tests, and nobody knows. Nobody can help me. And I think, you know, those are potentially the first patients that one really should refer, because people, when somebody's at that point, they feel like life has failed them. They feel like medicine has failed them, and that's always okay. But when you feel like God has failed you, then you're in a bad space, you know. So there are a few people that I've come across, you know, and offered to you know, to pray with, and just to sit and just chat, because something like that is really, it's a lot. It's a lot on young couples that had plans, you know, that still have plans, but they don't know. So that it is a big stigma in society, in unbelievers, but I think an even bigger one in the church, because people want to know, where's your God? You can't have children. Where is he? Where is he?
Right.
You know?
Right. Right.
So
You see, you make me think of a Bible study session that I recently attended, where the teaching was around Jeremiah 33:3. I'm going to paraphrase it because I don't have my Bible with me, but you know, where I think it speaks, it's along the lines of, show me things unseen, and the way that verse was explained to me floored me, because I was like, oh my goodness, had I known this all along. But really, it's, God, teach me how to pray for this baby. Teach me how to pray about being a mother. Not just show me what to pray for, but how to pray, so that you give back his words to him. Because, you know, I want to bring in adoption as part of our conversation, right? Because what if you were not called by God to have a baby in your womb, right? But you were called to mother, or to father, or to parent through adoption. What are your thoughts, Brendani?
In terms of adoption, I think particularly in Africa or South Africa, that is a very noble thing. It's a noble thing because there's a lot, our societal issues are actually quite large because of children who are not mothered, who are not fathered, who don't have that guidance. A lot of our problems and a lot of our illnesses, our drug abuse, our illicit substance abuse and whatever, it hovers around that. The fact that we don't have parents, you know, most, let me not say most, but a lot of African children suffer with that, you know. So I think adoption is a good way. Maybe you're not called to be a natural mother, but who says you can't be a mother? No one says, you know, no one says you can't be a mother still. You can still mother other children. And what I've found is that the people that sort of, I don't want to say relax, but sort of let go and let God, um, they'll adopt or whatever, and then 5 years in, they'll be able to conceive a child when they were
Right.
not thinking about it anymore, you know, when they were not stressing about it anymore, when they've allowed God to use them as a vessel to bless someone else, you know, to bless
Right.
someone else's child. They suddenly then have 2, 3 kids that are their own. And I found a lot of those stories. And I think it's more of a surrender, I suppose, and more of less striving and less working in your own power that allows that blessing then to flow through you. I'm not saying that everyone who's going to adopt will end up with their own child, but I'm just saying I've seen it a lot, that somewhere along the line, allowing God to use you the way he wants to use you, not the way you think. It opens up I don't know, it opens up a channel or ways. I mean, I'm actually thinking about some women that I saw in the clinic, I think about a year ago. She hadn't been able to conceive at all and actually adopted 3 of her sister's children. The sister had passed away and she adopted 3 of these children. And 10 years later, she had 3 of her own. And now she had 6 children, and that story has stayed with me, that, sometimes when you allowed God to use you, because she was telling me that when she finally came to a place of surrender and saying, God, your will, not mine, then it almost opened up a way. And she had like major structural issues, medically, she was not supposed to be able to. And she had 3 children to show that medicine does not trump God.
That's incredible. His ways are higher than our ways. That is such a beautiful story. Clementine, your thoughts?
Okay, so, I think we're talking about stigma and talking about adoption. I think that part of the stigma is that we as people always ask our friends, when are you conceiving? And the in-laws are always asking, when are you conceiving? The church is always asking, when are you conceiving? We don't necessarily care and say, oh, how is the marriage doing? Are you guys okay? And things like that. And so we are also promoting the fact that we're saying you're not woman enough until you have a child. And so we too can put pressure on other people. And when they have one child, you want to ask, when are you having the second one, without knowing the struggles that that people are going through. And so it's just to be very mindful of that. When I see a patient and they say, no, I'm single, I don't have children, and maybe they're of advanced age, I always ask, is it by choice or it just never happened for you? And if they say it never happened for you, how did you deal with it? And so I think we should be kind to other women and not expect that everybody wants to be a mother. Some people don't want to be mothers. I have lots of patients who say, no, it was by choice. I don't want those little things, And so I think one of that could help with the stigma as well. And I think also is, yes, we bring medical facts when we speak to patients. And so we will say, what, it looks like you're having this and this difficulties, and then to discuss options with people, So now there is in vitro fertilization is very expensive, is very painful. And the success rate sometimes is by chance as well. And so if we discuss options with other women, I feel like they can feel like they are empowered to not feel like, oh, well, just because I can't birth out a baby or I can't conceive naturally without help, then I'm not woman enough. With a lot of options there. Randy has spoken about adoption and how it's actually a very noble thing, but at the same time, it is difficult for, I think, Africans as well to adopt. We worry about the surname, the lineage, and all those things. It's still somewhat not culturally acceptable in certain cultures, where they'll be like, who's that child? When they start being sick, it's like, yeah, but we don't know who their grandmother is. And I'm not thinking about us as Christians, but we can encounter that. And I think in a church, it's just to preach that he is God either way, that my story might be different from your story. I always say that everyone in the Bible has a different experience of God, but the moral of the story is that he's God either way. And if we can preach that trust God, whether or not, like, don't trust God for a specific outcome, trust God for being God, whether the outcome is not what I had hoped for, whether the outcome is not what I had prayed for, or what people have been expecting of me, but if this is what you want for me, I will trust you. And I think that will also just put down the pressure from women feeling like we are not women enough until we have popped out so many babies.
Right. That is so true, Clementine. And you make me think of, actually, there's a handful of women that I have seen who are thinking about, is it harvesting? Is it called harvesting their eggs? because they feel they're approaching 5, they're single, not in relationships. Work is going well, career is flying, but there is this constant worry at the back of their mind: am I going to be able to have children? I still need to meet my husband. I still need to try for children. Busi, your thoughts before we wrap up?
Sure. I just wanted to throw a little question there in the air, especially Rendani, if you could just maybe attend to this. So one of the causes of infertility being PID, right? When PID causes damage to the fallopian tubes. Can you just take us through what is PID and how does one get PID, which then eventually leads to infertility? Because we see a lot of patients that have damage to fallopian tubes because they've had PID. So I think it is important to address what PID is. Brenda?
Sure. As you guys are all chipping in and stuff, I'm just realizing what a mammoth of a topic this is. I don't think we're going to be able to cover what I thought we'd be able to cover in one session. It's such a gigantic topic. But yeah, in terms of what you're saying, Busi, PID is, sure, I don't even want to come up with a percentage, but it's a really, really big cause for infertility in South Africa. And what PID is, it's called pelvic inflammatory disease. It's due to sexually transmitted infections, and it's commonly due to, I'd say, sexual debut at a young age. So starting to have sex at a young age, and having multiple partners, therefore, because obviously you started quite early, and not only that, but generally having multiple sexual partners, and you're predisposed to a wider range of bacteria, viruses, blah, blah, blah. So it's a sexually transmitted disease, basically. And we see a lot of it. I just can't even tell you how big of a problem it is, which is why Busi is alluding to it. And the problem is that it's quite an assault on the body. It's quite an assault on the uterus, on the fallopian tubes, on the ovaries as well. It causes everything to basically stick together. So your tubes don't beat properly. They can't receive sperm when it's time to receive sperm and for you to actually conceive. There's sometimes complexes, it's called a tubal complex, that causes you to not be able to conceive as well. It causes blockages. In layman's terms, it causes blockages that don't allow you to conceive. And I think Busi is alluding to it because it's important for you to know, this kind of diagnosis, because this kind of diagnosis we can deal with antibiotics if it's early on. But sometimes when it's very, very advanced, there's almost nothing we can do about it, which is quite sad. I mean, in terms of fertility, in terms of treating the infection, we can treat the infection, but sometimes we need to aggressively deal with the tubes and stuff, therefore rendering you infertile. So I think Busi wants us to educate people, in terms of that, and in terms of multiple sexual partners, basically, and not testing for certain things before you engage sexually with someone.
This was, yes, Busi, continue.
Sure. So what I wanted to bring about with regards to that, this is not to be judgmental at all. But, as we grow up, myself, as I grow up, you find that only now do you understand why the Lord taught us, right? What does the Word of God teach us? The Word of God teaches us that any sexual relation outside of a marriage is called adultery. So what society has deemed to be acceptable, teenagers having sex, 14-year-olds having sex, 13-year-olds having sex, people having multiple sexual partners, people having sex with people who are not their husbands and not their wives. The immoral fiber that we are struggling to deal with as a society has consequences. There are reasons why the Lord has warned us in the book of the law to conduct ourselves in a certain manner. If it wasn't for that, if it wasn't for our wicked ways as human beings, then there are some diseases that are really preventable, such as, like Rendani has explained, early sexual debut, multiple sexual partners, So when you start to see the physical manifestation of the ways in which we as people have failed to conduct ourselves according to the spiritual laws, then you realize how serious this is. Then you realize that God is a God of wisdom, of knowledge, of understanding. He doesn't guide us just to be a certain way. He guides us because he knows better. He says in Isaiah 55, he says, my ways are higher than your ways. My thoughts are higher than your thoughts. He knows things that we don't know. So let this be an encouragement to everyone who is listening. Let's first start with the spirit, because before you were the clay that you are, your spirit. Let us all be aligned to what the Lord has instructed us to do, and let us try by best means to live lives that fulfill how we should look after our temples, and then some things really can be preventable. I know there are other causes of infertility. I'm not saying PID is the only cause. I'm just saying what is preventable, let us prevent. For example, smoking. Smoking will damage. Smoking also causes this cilia not to move and sweep the eggs, as much as it should. So our lifestyle modification, there's reasons why we're encouraged to live healthy lifestyles, exercise, look after yourself, eat healthy diet, all of that, it contributes. So I think the more we learn to look after our temples, then some challenges might not come our way. So yeah.
Final thoughts from Rendani? Clementine?
I just had a few questions from Instagram that I'd want us to not forget.
Right.
So,
can I perhaps interject here? Because like you were saying, as we were talking, I'm just like, sure, this really is a mammoth of a conversation, right? I thought we would have enough time because I also got Instagram some questions, but I'm wondering, and this is open for us to decide now with the viewers, right? Should we have more questions sent in so that we also know what it is that we're covering, not just kind of fly here and there? What are the thoughts?
Yeah,
actually, I think that's a good idea. Maybe we can have a Q&A session, which will be different from, because we've run out of time. So maybe a Q&A session would actually help. Yeah,
I agree.
Ladies, thank you so much for such an insightful and wonderful conversation. And to our viewers, please, please, please DM us your questions. We are on Instagram. You can also, I think you can send them via YouTube. I'm a newbie to YouTube, so I'm not sure. Or you can email them to allthingswomen2021@gmail.com. Thank you. We look forward to seeing you in 2 weeks' time. Call your friends, call your mothers, call your partners, call your cousins, call everyone and share. Thank you, guys. Bye.
bye.
Bye.